Hello! So today I have a little video lecture for you about direction, position, and movement terms in veterinary medicine. So the first thing that we need to talk about when we're talking about the directional terms is planes. So planes are basically imaginary lines that we draw on the animal and it divides them up. So the first plane that we talk about is the mid-sagittal plane. So the mid-sagittal plane, if we imagine drawing a line down the animal from the nose to the tail. It's also sometimes called the median plane or the midline. So it's right along the middle of the animal. And that mid-sagittal plane divides the animal into equal left and right halves. So it divides the animal right in half into left and right. We also talk about the sagittal plane. So the sagittal plane is a line going from the nose to the tail, but it's not along the midline. It could be anywhere along the animal. And what that sagittal plane does is it divides the animal into unequal left and right parts. Okay, so the mid-sagittal is right along the middle, and it divides into equal left and right, and then that sagittal can be anywhere still in that direction, and it makes unequal left and right halves, okay? So the next plane that we talk about is the dorsal plane. So the dorsal plane, if we drew a line along the animal this way, that's the dorsal plane, and it divides the animal into dorsal. If you remember back to your word parts, dorse is back. So the dorsal is the back of the animal, and then the ventral, which is the belly of the animal. So that dorsal plane divides the animal into dorsal and ventral parts. So our next plane is the transverse plane. So if we drew a line across the animal this way, so remember again to our word parts, right? Trans means across. So if we drew that line halfway across the animal, we're dividing them into head and tail, or cranial and caudal parts, okay? So this plane is also sometimes called the cross-sectional plane because it crosses across the animal and just sections them. But transverse plane I find is easier to remember because that trans means across, right? So the transverse plane divides the animal into cranial or towards the head and caudal towards the tail parts. That transverse plane can also be used on a limb. Here, I got another puppy here with a bit of a longer limb. So this guy, if we use that transverse plane across a limb, it divides the animal into distal or more distant, and then proximal parts. So proximal means closest to the point of attachment, distal means furthest from the point of attachment. So that transverse plane can be used on a limb as well. So why do we care about these planes? What are we even supposed to do with them? So one thing that we can do with them is use those terms to make directional terms, okay? So we don't want to use terms such as behind or above or near or below. Those kind of terms just are very subjective, which means that they might mean different things to different people. So if I have to describe on this animal a lump and I say it's behind the ear, does that mean that it's down here? Is it behind the ear back here? Is it behind the ear up here? It just all depends on where the person's looking to see where it is behind. But if I use a term like caudal to the ear or towards the tail from the ear, I know that it's right here behind that ear, okay? So we want to use terms that are surefire terms, things that mean the same thing to everybody. Again, this all just goes back to our files, right? We want to make sure what we're writing in our files can be understood by everyone that's reading them. So if we use really loose terminology like top or bottom or underneath, those can mean a lot of different things. But if we use these directional terms, then we know that we're communicating properly what we're trying to say. So I have in your notes, I have them all grouped in opposite pairs. I find personally it's easiest to study things in opposites. I find still to this day, and I've known my terms for a very long time now, if I hear the words distal and proximal, I have to think of distal equals distant. Okay, so that's further away than the proximal, which is near. So I often have to think that one through still. So having those pairs in your head, I find is easier, because if you know one for sure, you know the other one for sure, because it's the opposite. So our first term is cranial. So cranial means towards the head. Think cranium, right? The cranium is your brain, right? So your cranial is towards the head. The opposite of cranial is caudal, or towards the tail, okay? On the head, we have a specific term that we're going to use when we're speaking about on the head of an animal. Because on the head, we can't say something is more cranial, because the head is cranial, right? So we want to use the term rostral. So rostral means towards the nose. Rostral kind of sounds like nostril, right? So hopefully that's easy for you to remember. So rostral means towards the nose, and the opposite of rostral then would be caudal, because it's just towards the tail, okay? Our next term, we have the pairs medial and lateral. So you probably remember from your word parts that later means the side, right? So lateral means more towards the side of the animal. Medial kind of sounds like medium, right? Sounds like right along the middle. So medial is right that midline. Okay, so medial is closer to the midline, lateral is further away from the midline or more to the side. So those two guys are opposites. Next we have dorsal and ventral, right? So dors meant back, so dorsal's referring to the back, ventral's referring to the belly. On a limb, I'm going to switch puppies here because this guy has just a nice long limb. Distal means furthest from the point of attachment to the body. Proximal means nearest to the point of attachment on the body. So proximal is nearer, distal, or sounds like distant, is further away. So we can use proximal and distal on limbs, hind limbs and forelimbs. We can also use it on the tail. So this would be the most distal point of the tail. This is the most proximal point of the tail. So furthest from the point of attachment, nearest to the point of attachment. So our next two terms, we have palmar and plantar. So palmar, think palm, the palm of our hands. It's the bottom part of the front limb. So the part that touches the ground when the puppy's walking, okay? So that's the palmar aspect of the foot. And then the hind foot is plantar. So maybe you guys have heard of plantar warts, right? Plantar warts happen on the bottom of your feet. They're called that because they're on the bottom of your feet. So plantar is referring to the bottom, so the bottom of the hind feet. Okay, so we have palmar on the front, plantar on the back. And then our next two terms, we talk about deep and superficial. I feel like these ones are fairly self-explanatory. Superficial is the surface of the pet, okay? So the surface area, the skin is the most superficial organ on an animal. Deep is internal, so like the stomach and the heart and the liver, those are all deep. They're further in or internal away from the body's surface, right? So we can use deep and superficial, like let's say we're talking about a wound, right? So if an animal had a surface scratch and it just, didn't get all the way through the skin, we would say that that's a superficial wound. If the animal got like stabbed with a knife, that would be a deep wound, okay? So those are our different directional terms. So we have those planes, and those planes divide the animal up to make those opposites of the terms, okay? So things like cranial and caudal, that's created by our imaginary transverse plane. We have our imaginary dorsal plane, which gives us the opposites of dorsal and ventral. And then we have, of course, our mid-sagittal plane, which gives us the left and the right sides. I feel like I'm missing one. Oh, I guess just the sagittal plane, which gives us unequal right and left sides. Okay, so those are our directional terms. So you'll notice in your notes you do have some diagrams as well that show you the cranial and caudal and proximal and distal. So you can use those to help to study. We also have an @Dove video that I posted for you to look as well, and that's one of the @Dove technologists running through those directional terms as well for you. So like I said, we want to use those to make sure that we're communicating things really well. So right now, for our purposes for test 2, I want you to just focus on memorizing what those terms mean. So cranial means towards the head, caudal means towards the tail, and etc. Okay. We are going to move on to applying those terms, but we'll do that a little bit later on. Right now, I just want you to know what each term means. So cranial towards the head, etc. Proximal, nearest to the point of attachment, distal, furthest from the point. Okay, so work on memorizing those for now. So we're finished talking about direction. We're going to move on to talking about position. So in veterinary medicine, we have to have fancy words for everything. We can't say an animal's just lying down. We have a fancy word for it, and that fancy word is recumbent. So recumbent just means laying down. It's the medical term for lying down. Now, when we talk about recumbency, we talk about what part of the animal's body is touching the table or touching the floor. So if we have an animal laying on its belly like this, that's ventral recumbency, because the ventral aspect of the animal is touching the ground. Sometimes this one's also called sternal, because this is the sternum, the chest, like the breastbone is the sternum. So if the sternum's touching the ground, then often it's called sternal as well. So sternal and ventral are both names for the same position, and that's laying down with the belly touching the ground. If I want to lay the animal on its back, so like this is called dorsal recumbency, because the back is touching the ground. So dorsal recumbency means laying on the back or laying on the spine. Then we can talk about lateral recumbency. So again, remembering back to your terminology word parts, later meant side. So lateral recumbency means the animal's laying on its side. But we want to be a little bit more specific when we're talking about lateral. We need to talk about which side is touching the ground. So is it going to be left or is it going to be right lateral? When we're talking about right and left, we talk about right and left from the animal's perspective. So on this guy, this is the animal's right, this is the animal's left. So I don't talk about it looking at him, okay? Because then my right is actually this guy's left, okay? So we talk about it from the animal's perspective. So this guy right now is laying in left lateral because the left side is touching the ground. And then if I flip him over on this side, now he's in right lateral because his right side is touching the ground. Okay, so we have, just to recap, dorsal recumbency, laying on the back, ventral or sternal recumbency, laying on the belly or chest, left lateral recumbency, laying on the left side, and right lateral recumbency, laying on the right side. So those are our positional terms. You'll encounter those a lot in this course. You'll encounter it a lot in practice. So make sure you know your recumbencies. Okay, and then our last subject here is movement terms. So there are 4 different types of movements that we need to learn about for this course. So the first one is flexion. So flexion, the definition is closing of a joint angle. Or you could say reduction of an angle between 2 bones. So I'm going to talk about right now, my elbow is going to be my reference point, okay? So right now I have flexed my elbow. I've closed this joint angle. This joint angle has gotten smaller. Or I've reduced the angle between the 2 bones, so these bones and these bones. So I'm flexing my elbow right now. And that kind of makes sense, right? People talk about flexing their biceps, right? And they have their elbow bent for that. So hopefully that helps you to remember flexion. So that's closing a joint. The opposite of flexion would be extension. So that's straightening a joint. Again, I've straightened out my elbow here. Or you can say the increase of the angle between 2 bones. I personally like the definitions: closure of a joint, straightening of a joint, because that's nice and easy to remember. So flexion, extension. Okay, so our next 2 terms are abduction and adduction. So you guys probably remember from your word parts that duct means to lead, and then ab means away from, and ad means towards. So if you use your word parts, you already know the definitions to these terms. So abduction is going to mean to lead away. In this case, we're going to talk about, our reference point is going to be the midline of the body, okay? So right now I'm going to abduct my arm. So I'm abducting it. I'm moving it away, or I'm leading it away from my body, or the midpoint, okay? So abduction is movement away from a midline, and then adduction is movement towards the midline, okay? So abduction, adduction. So those are the two, or the four, movement terms that we use in vet medicine a fair bit. I'm just making sure I covered everything here. So again, in your information package, or in the printed notes that you have on the Brightspace, there are diagrams for each and every one of these things. So there's diagrams for flexion, extension, abduction, and adduction. There are diagrams for all the recumbencies, and then there are the diagrams showing you like those planes, and then craniocaudal, dorsal ventral, that kind of thing. So I hope this video has been helpful for you. If you do have any questions, of course, make sure you please let me know. Thank you so much.